Half-life, the missed dose. Two patients forget to take their medicines for a day. In one patient, the drug level falls rapidly and its effect is soon lost. In the other, enough drug remains in the body to continue producing an effect. Why does one drug disappear quickly while another remains much longer? The answer lies in its half-life. What is half-life? Half-life is the time required for the plasma concentration of a drug to decrease by 50%. Mathematically, half-life is given by 0.693 multiplied by the volume of distribution, or Vd, divided by clearance, or Cl. This concept applies to drugs following first-order kinetics, where half-life remains constant regardless of dose. Half-life helps determine the duration of drug action. In general, drugs with a longer half-life remain in the body for a longer period. Factors affecting half-life. As shown in the formula, half-life is directly proportional to volume of distribution, or Vd. Therefore, a higher Vd means a longer half-life. When a drug distributes widely into tissues, it returns more slowly to the plasma and is less readily available for elimination. This is commonly seen with lipophilic drugs such as diazepam. In contrast, half-life is inversely proportional to clearance, or Cl. Therefore, lower clearance means a longer half-life because the drug is removed more slowly from the body. Clearance depends importantly on liver and kidney function. If these organs are impaired, clearance may decrease, prolonging the half-life. This is clinically important because dose adjustment may be needed in organ failure. So, remember the relationship. Half-life is directly proportional to Vd and inversely proportional to Cl. Clinical importance. Dosing interval. Now, let us see how half-life influences the dosing interval of a drug. Drugs with a very short half-life, lasting only seconds to minutes, disappear rapidly from the body. Therefore, they may require a continuous infusion or very frequent doses to maintain their effect. Drugs with a short half-life, lasting a few hours, may require multiple daily doses to maintain therapeutic levels. In contrast, drugs with a long half-life, lasting days, remain in the body much longer. Therefore, once daily or even less frequent dosing may be sufficient. So, the key principle is, half-life directly guides how frequently a drug must be administered. Clinical importance. Time to steady state and elimination. When a drug is given repeatedly, its concentration gradually rises until steady state is reached. For most drugs following first-order kinetics, this takes approximately 4 to 5 half-lives. The same principle applies when a drug is stopped. Near complete elimination also occurs after approximately 4 to 5 half-lives. Why does this matter clinically? This guides when to expect full therapeutic effect and when a drug is safely cleared from the body. So, remember this important rule. Both steady state and near complete elimination require approximately 4 to 5 half-lives. Clinical takeaways. Finally, let us summarize the clinical takeaways of half-life. First, dosing frequency. Half-life helps determine how often a drug is given, from continuous infusions to once daily tablets. Second, steady state. With repeated dosing, steady state is generally reached after about 4 to 5 half-lives, the point of consistent therapeutic effect. Third, safe elimination. After stopping a drug, near complete clearance also takes about 4 to 5 half-lives. This becomes important when switching or stopping therapy. And finally, organ failure. Renal or hepatic impairment may reduce clearance and prolong half-life, which may require appropriate dose adjustment. Common Viva questions. Before we finish, try answering these two commonly asked Viva questions on half-life. 1. What is the relationship between half-life, volume of distribution, and clearance? 2. How many half-lives are required for a drug to reach steady state or be almost completely eliminated?